On 7 Up Front tonight, the COVID-19 surge in Michigan and its impact on health systems and hospitals. Joining me tonight is Bob Riney of Henry Ford Health System. He is president of healthcare operations and chief operating officer. You saw him a moment ago in Jim's report. Mr. Riney, thank you for being there tonight.
Good evening, Dave.
As we head into the weekend, how concerned are you about COVID capacity levels in your hospitals and with where we're at overall right now here in Southeast Michigan?
Well, we remain very, very concerned. We are now in our third week of all of our hospitals, basically between 93 and 95% capacity, which means that we're virtually full. And we've been able to get discharges of COVID patients earlier than previous surges. But as our nurses say, for every discharge, there's a new one in the ER waiting for an admission. So we're also concerned because our lab positivity rates, we've been testing about 2,000 people a day since the very beginning of this first pandemic in spring of last year. And we had gotten our positivity rates down to about 4 to 5% a day when we were seeing really a much better state than we're in now. Today, our positivity rate was 20%, meaning 1 out of every 5 people that we're testing. So we've got some great worries that we have to get our arms around.
So as Jim mentioned in his report, the state extending these current restrictions for a month and requiring masks for children as young as 2. Today we had nearly 9,000 more infections reported. Should the governor have put more restrictions in place this week in light of the numbers we're seeing?
You know, you can really talk about policy, but at the end of the day, policies of what goes on in individual homes are so difficult to actually police. I really think this is up to Michigan citizens. We have to take this seriously, and we have to know that we all have a responsibility to break this cycle. It's frustrating to hear people say, I want to get back to normal, because we all do. But you don't get back to normal till we break the cycle of the virus. And we've got to get people vaccinated, and we've got to get people practicing the safe behaviors that we know have worked in the past, no matter how tiring it is.
Yeah, it is tiring for all of us. There's no question about that. Who's being treated in your hospitals right now compared to when the crisis first hit or even last fall? Patients younger now, and do you feel vaccinations are playing a role in that if those numbers are younger?
Yeah, patients are definitely younger. We are seeing patients that are in their 20s, their 30s, their 40s that are quite sick. We are seeing a lower number of seniors, and that is really factually the validation that the vaccines are working, because they were vaccinated first and they've been vaccinated in higher percentages. So I tell people everywhere I go, the vaccines are working, and now we're getting people in our hospitals that either have not had the opportunity to be vaccinated, or in some cases, as frustrating as it is, have chosen not to be vaccinated.
Yeah, and there are many in that camp, unfortunately. Our family knows from personal experience this week that ERs are jammed right now, and the pressure that's putting on all health systems. What will help your hospitals? What's the message you'd like to offer to our viewers as we head into the weekend? Practice those safe protocols?
You know, it's practice the safe protocols. And for those of you that are reluctant to get the vaccine, I really urge you to rethink that